Meanwhile, WHO Director General Tedros Adhanom Ghebreyesus said during a press briefing on January 6 that while Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it doesn't mean it should be categorized as mild. Let's listen in.
Last week, the highest number of COVID-19 cases were reported so far in the pandemic. And we know for certain that this is an underestimate of cases because reported numbers do not reflect the backlog of testing around the holidays, the number of positive self-tests not registered, and burdened surveillance systems that miss cases around the world. While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous variants, Omicron is hospitalizing people and it's killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world. Hospitals are becoming overcrowded and understaffed, which further results in preventable deaths from not only COVID-19, but other diseases and injuries where patients cannot receive timely care. First-generation vaccines may not stop all infections and transmission, but they remain highly effective in reducing hospitalization and death from this virus.
Having the context of confirmed cases being put in quarantine or quarantining at home is really critical to prevent the onward spread. Now, we know that that is very difficult to do. We know that that takes effort. People need to be able to not work and be supported in not work, be supported in quarantine to make sure that they can provide for their family, that they have food, et cetera, et cetera. And that is not a small matter.
For every day you reduce the quarantine, a small proportion of people will go on to develop symptoms and potentially affect others. But you could say that's 14 days or 40 days, and you can go into a very long period. So this is a trade-off. The science gives you a range, and that range peaks, I think, at about 5 or 6 days, and then falls off exponentially. So based on a country's need, based on the economy, based on the availability of teachers, health workers and others, based on the availability of tests, countries have flexibility within that to set the periods of quarantine that meet their goals.
Dr. Tedros called upon citizens of the world, including civil society, scientists, business leaders, economists, teachers, to demand that governments, pharmaceutical companies, to share health tools globally, bring an end to the death destruction of this pandemic. He also stressed that we need vaccine equity, treatment equity, test equity, and health equity.